Today is Thursday, February the 10th. This is the Multnomah County Board of Commissioners regular Thursday board meeting. And the health and safety of our community and staff members are still and continue to be at the forefront of our minds as we continue to navigate county business in light of the COVID-19 pandemic. In accordance with the declaration of emergency, some board rules have been temporarily altered. Today's board meeting is a hybrid board meeting, which means that some presenters and guests will appear in person and some will appear virtually. For those who are presenting virtually, please mute your mic when you're not speaking and remember to unmute your mic and turn on your camera before you present. For those who are appearing in person, please wear your face covering at all times while in the building. And if you're presenting, please state your name before responding to questions for those who are listening remotely. May I please have a motion on the consent calendar?
Second.
Commissioner Vega-Peterson moves, Commissioner Jayapal seconds. The approval of the consent calendar, the board clerk will now take a roll call vote.
Commissioner Myron?
Aye.
Commissioner Jayapal?
Aye.
Commissioner Vega-Peterson? Commissioner Stegman?
Aye.
Chair Kafoury?
Aye, the consent calendar is approved.
So Madam Chair, we had one person signed up for oral testimony. Today, their name is Dar Crammond. I'm not seeing them on the call. I will reach out to them if they have any written comments.
Thank you.
I will move on to R1.
All right, we're going to recess as the Multnomah County Board of Commissioners and convene as the governing body for the Dunthorpe Riverdale Sanitary Service District Number 1.
R1, resolution approving a petition to annex a single parcel of land to the Dunthorpe Riverdale Service District pursuant to ORS 198.857 and authorizing the chair to provide the district's endorsement on the petition.
Commissioner Vega-Peterson moves, Commissioner Stegman seconds, approval of R1. Good morning.
Good morning, Chair Kafoury and Commissioners. For the record, my name is Chet Hagan. I'm a program manager in the Department of Community Services and administrator for the and Metro Code 3.09. The property we're considering for annexation is located adjacent to the far southern and boundary in unincorporated Multnomah and Clackamas counties, and the property's address is 13175 Southwest Iron Mountain Boulevard. The service district provides sewer service to properties in both Multnomah and Clackamas County, and since the majority of properties are within Multnomah County, our board acts as the governing body for property in both counties. The property is currently unoccupied, and the petitioner is asking to annex a single 0.89 acre parcel of land in order to connect a single family home, which is currently on a septic system, to our public sanitary sewer system. Since the property is within the urban growth boundary and inside the city of Lake Oswego's urban service area within the Birds Hill neighborhood, the petitioner has agreed to enter into an annexation contract with the city of Lake Oswego. The tax lot in Multnomah County is not scheduled for annexation by the city of Portland in the foreseeable future. District staff coordinated very closely with the county attorney's office on this petition, and today we recommend that the district board approve the petition for annexation. The district has the capacity to provide sanitary sewer service to the property from nearby infrastructure. The development aligns with the city of Lake Oswego's comprehensive plan. The city of Portland has no plans to annex the Multnomah County tax lot or immediately provide public sewer services. And finally, the petition is complete and complies with statute and Metro Code. And with that, I'm ready for any questions that the district board may have.
Thank you, Chet. That was very thorough. Do we have any public testimony, Marina?
No, Madam Chair.
All right. Commissioners, questions, comments? Commissioner Myron.
No questions. Thanks, Chet.
Commissioner Jayapal?
Thank you, Chet. No questions.
Commissioner Vega-Peterson?
No questions. Thank you, Chet.
And Commissioner Stegman?
Thank you, Chair. Thank you, Chet. I did have one quick question. So to hook up to our sanitary service, is that a cost that's being incurred by the homeowner or the person who's building?
Yeah, good question, Commissioner Stegman. That's correct. So this is the first step in the process. We say you are allowed to connect to the sewer district's pipes. And then later, when they actually apply for a permit, the homeowner will pay for all of the fees in order to connect to the district's sewer system.
Great. So there's no cost to Multnomah County.
That's correct.
Great. Thank you, Chet.
No problem.
Question, Commissioner Stegman. All right. Marina, would you please take a roll call vote?
Commissioner Myron,
Aye.
Commissioner Jayapal,
Aye.
Commissioner Vega Peterson, Commissioner Stegman,
Aye.
Chair Kafori.
Aye. The resolution is adopted. Thanks, Chet.
Thank you.
We will now adjourn as the Dunthorpe Riverdale Sanitary Service District Number 1 and reconvene as the Multnomah County Board of Commissioners.
R2, Budget Modification DCJ 01222, Budget Modification DCJ, reducing MCJRP program by $44,503 to reflect final grant award.
So moved.
Commissioner Jayapal moves. Commissioner Vega Peterson seconds. Approval of R2. Morning, Abby.
Good morning, Chair Kafori. Good morning, Commissioners. For the record, my name is Abby Stamp. I'm the Executive Director of the Multnomah County Local Public Safety Coordinating Council, the entity that is the applicant to the Oregon Criminal Justice Commission for this grant, the Justice Reinvestment Grant Funds. And with me today is Jay Scroggin, Assistant Director at the Department of Community Justice for the Adult Services Division, as DCJ has wonderfully taken on the onerous task of administering the finance pieces of this pretty complicated grant that has allowed us to successfully keep so many people from going to prison. So I just want to hand the baton over to Jay.
Thank you, Abby. For the record, Chair Kafori, Board of Commissioners, I'm Jay Scroggin with the Department of Community Justice. I'm the Adult Services Division here. And I am here, like Abby said, to go through some of the details on this budget modification. This is to approve $4,757,013. That's what we got for the biennium from this grant. This is a result of the Criminal Justice Commission's award in two groups. There is what's called the formula grant of McJERP, and then there is a supplemental grant, and it's all related to House Bill 3194, which I believe is 2013 legislation. I can't believe we're getting close to a 10th year on this. It seems like it was yesterday. But on the formula is set. It's dictated by the legislature, and then our pot of that is based on our adult population. That's how that's allocated. Our adult population went down this biennium compared to last. We got 17.77% of this compared to 18.12 in the prior biennium. However, with carryover and just the amount that went into that, it didn't result in a huge change for us there. The bigger hit was the supplemental. Supplemental grant is a competitive grant. All 36 counties get to compete for the amount that is allocated. In that grant, we actually got one of our positions that was not put forward. So the net result of this is, I'm going to start with each department. The net result is the $4,757,013 to be distributed over the 2 years. Within that, 10% of the funds goes to victim services. That's both supplemental and formula grant. We are awarding those funds to the Crime Victims Law Center. We are awarding them to the Immigrant and Refugee Community Organization, IRCO, who provide advocacy to victims of human trafficking. And the last group is Lutheran Community Services, who provides advocacy to unserved victims of crime. So those two groups or those three groups are going to be working with the 10% from this grant. In addition, we took the option to apply for the 3% data or IT research piece of this grant. We were awarded $112,000 in research. That is to continue to put out the numbers that we're doing, the impacts that we're having on our community based on the programs. As our program continues to go on, focusing on people with presumptive prison sentences and deferring them from that, but also some of the new work that we've been doing. Specifically, we've been doing a whole bunch of work around pass-through money that goes to the defense for caseworkers and some of the stuff that they do with that population. The actual breakdown in DCJ, we had a growth of $5,789. However, because it is position specific on the supplemental, we had our community health worker on our Women in Service Family unit not funded. So in addition to hoping that you approve this budget, we are a part of it is the reduction of that one FTE. Lipstick has an increase of $20,937 to continue to do the work that they do and to support the victim services providers. Multnomah County Sheriff's Office saw a budget increase of $18,538. The District Attorney's Office of $10,817. And with that, I'm going to pass it over to Abby to fill in any of the gaps that I might have left off.
Nope, Jay, you got it. And just as a reminder to the commission, we did come in September and do a very comprehensive presentation of the entire Multnomah County Justice Reinvestment Program and the continuation of our work with the state to ensure that we fund social workers and the staff needed to really support folks who were able to maintain in the community instead of sending to prison. Thank you.
That's it? No more speakers? All right. Marina, did we receive any public testimony on this item?
No, Madam Chair.
All right, commissioners' questions. We will start with Commissioner Jayapal.
Caught me by surprise. I know, switching it up. Thank you so much, Abby and Jay. Don't think I really have any questions. Just, I'm always struck by how counterintuitive it is that the better we do, the less funding we get on the Justice Reinvestment Program. But glad to have some additional funds for victim service providers. Thank you for your work on this.
Commissioner Vega-Peterson?
Thank you, Chair. Thank you, Abby and Jay. I also don't like that illogic of that funding formula, even though I passed that bill in 2013, but how it was enacted is always interesting. I did want to, and I also really appreciate the investment that we're doing for victim services with those three really worthy organizations. But I did have a question about the loss of the 1.0 FTE specialist. What are some of the work that this person or that this role did, and is there any backfill for this, or is this just going to be a loss of services for folks?
Commissioner Vega-Peterson, Chair, great question, and I have an answer. So the first question, what does it do, right? I would think of it, when you're talking about downward departures for presumptive prison cases, the most important thing that we want is that they stay in the community, that they stay on probation, and that they don't become a revocation moment, because when you get revoked on this population, you go to prison. So these people would be released, go to the Women in Service Family unit. This person would be directly assigned to them. So they have their own mentor, their own navigator, their own, to get them attached to services, be that mentor, be that lived experience support person. And we found right away that our amount of revocations for that population was very, very, very low. In fact, I don't quote me on this, but we had under a handful within a given 6-month period of time. And that used to not be the case. So we actually saw direct results. We did give that to the Grant Review Committee, and they understand that, but under some of their definitions for wraparound services and what can be awarded within the supplemental, it just didn't make the cut. How we continue the service? Well, the commission, you guys, the commissioners here, in our budget 2 years ago, we actually finally tried to get out of having these positions funded by grants and having it more be general funded. So we actually got a general funded community health worker within the Women in Services, Family Services. The good thing there is when you have a general fund, they can do anything. When you have a grant funded one, they can only work on people assigned to the grant. So we actually have someone that can actually touch that population anyway. Now they have their own caseload to do. I mean, they have a whole unit of 15 POs that they have to service. So we're gonna watch that pretty closely. We do not intend to, because they're McJerp, we are not going to touch them. If they need the services, they're going to get it. But we're going to be watching that as we work through this. And if we need to get another through general fund, you might see that in a budget ask. But for right now, that's how we intend to service that population, is with our county general funded position.
Thanks so much, Jay, for that explanation. And please let us know how that goes in terms of the outcomes that we're seeing because of the loss of that position. Thank you.
You bet.
Commissioner Stegman.
Thank you, Chair. Thank you, Jay and Abby. So I just want to make sure I'm understanding this, Jay and Abby. So the 4.7 is the formula grant. And so are we saying that we thought historically we got around 18.13%, but we only got 17.7, and that's why you're coming before us today?
Very confusing. Yes, I will try to make it more clear. The 4.7 is the combined ask, that is formula and supplemental. Just formula, we budgeted 3.4 million in 2022. In this biennium, we are budgeting 3.8. So a difference of about 400,000 as a increase just in formula. Some of that though is with $81,000 of carryover, but that allocated amount, even with us getting a smaller slice of the pie, 17.77, still was a increase from what we budgeted in 2022.
Great. So that carryover kind of helped.
It did with the formula. The bigger, what kind of made it all, hey, we're $800,000 up. How are we not? The supplemental was much less, because they cut with that one position. That's like $380,000 that they cut out of our supplemental ask.
Great. Thank you so much.
That's what balanced out.
Commissioner Myron.
Thank you. I had also wanted to mention the, the disincentive and illogic, as Commissioner Vega-Peter said, of that formula, and that we're penalized for doing the great work that we do. So just put that out there. And I'd also had that question about what happened with the money for that additional worker. And so it's great to know that there's a position that will have a little bit more flexibility and will be hopefully sustained in the longer term and not dependent on grant funds. And so I think you answered this question already, but just to double check. So you're gonna keep an eye on that and see if that's sufficient to meet the needs that we have. If we need more, then we'll address that.
Commissioner Myron, yes, that is correct. I think you said it right. The position has more flexibility, but they just got more work, right? So that's what we're going to look at over the next year. We're going to look at the work, and if we can do it, we can do it. But if not, then we need to have a conversation. It'll probably start at the lipstick, but McJerp meetings. Hey, we're dying here. How can we do it? And maybe we look at it through more of a permanent issue with you all at a future budget.
Great. Thanks so much, Jay. No more questions.
You bet.
Thank you, Jay. Thank you, Abby. Marina, would you please take a roll call vote?
Commissioner Myron?
Aye.
Commissioner Jayapal?
Aye.
Commissioner Vega-Peterson? Commissioner Stegman?
Aye.
Chair Kafori?
Aye. The budget modification is approved.
R3, resolution affirming Multnomah County's commitment to clean air.
So moved.
Second.
Commissioner Myron moves. Commissioner Jayapal seconds. Approval of all three of R3. That was the shortest title
I know.
of ever, with no crazy numbers or acronyms. It was very succinct to the point. I think we just vote now. Just kidding. All right. Welcome, John.
Hi, I believe Commissioner Jayapal is going to kick us off today.
Thank you, John. I am. Thank you, Chair. So it is such a pleasure to be partnering with Commissioner Vega-Peterson to bring this resolution forward. I think we got a preamble to it in the briefing on Tuesday, and this is the next step, and there's many more steps to come. This resolution affirms the basic, incontrovertible principle that everyone, everywhere, deserves to breathe clean air all the time. One of the main impediments to breathing clean air in Multnomah County and around the world is wood smoke. Like many of our neighbors in Multnomah County, I didn't know just how bad wood smoke is for our health until I started hearing about it from constituents, about their everyday struggle to breathe, about how they were often trapped in their homes because of wood being burned in a fireplace or a fire pit next door. The evidence is clear. Multnomah County has some of the dirtiest air in the state and in the country, and wood smoke is one of the leading causes of that dirty air. It's also clear that air pollution is a health equity issue. Disproportionate exposure to air pollution contributes to the higher rates of illness and death for Black, Indigenous, and other people of color. Taking action on wood smoke pollution is therefore something we are called on to do by our recognition of racism as a public health issue and our commitment to eliminating health inequities. This resolution comes out of the Wood Smoke Work Group convened last year and builds on the significant body of work already undertaken by the county in years past to clean our air. By stating clearly our vision of clean air for everyone, everywhere, all the time, our commitment to striving for specific air quality benchmarks, and our recognition that wood smoke pollution is a health equity issue, the resolution sets forth the principles for our continued work. The most important component of that work is education and culture change. I didn't know how harmful wood smoke was till the advocates educated me, and I haven't been able to look at a wood-burning fire pit the same way since. That's the culture change we need to create through our community. We began that process with our existing wood smoke ordinance, sponsored by Commissioners Vega-Peterson and Myron in 2018. Next week, we'll introduce an ordinance that builds on that work in several ways, the most important of which is a change that recognizes that there are no good days for wood burning. There is no green light. And in the months to come, we'll begin to implement additional strategies generated by the Wood Smoke Work Group, members of which you'll hear from today. I'm particularly excited about the wood stove change-out program we'll be piloting with $500,000 in federal ARPA funding. This was one of the strategies prioritized by the work group, and I want to thank Senator Dembro for securing those funds. Our shared districts contain a significant number of households that burn wood for heat, often because they can't afford to change their systems. And this funding offers us a chance to help those households move to cleaner sources of energy. I'm hopeful that the pilot will be just a first step and will allow us to access other funding sources to expand this work countywide. The resolution provides the foundation and framework for the wood stove change-out pilot program and for the other strategies to follow. With that, I would like to turn it over to John and our great panel to talk about and introduce the resolution.
Thank you, Commissioner Jayapal. Thank you, Chair and Commissioners. My name is John Bashatinsky. I'm the Director of Sustainability. I know it says Nadej is back there to help me in case I get bogged down and need an expert. But I'm going to be presenting today, and I'll probably zip through my presentation so that we can get Dr. Moses and the rest of the panel to be able to give their testimony. Next slide, please. So we're going to talk a little bit about why we're doing the resolution, a little bit more about health impacts related to wood burning, get into the details of the resolution as well. So we are, one of the main things the work group recommended was that, next slide. One of the main things the wood smoke work group recommended was that we set a vision for our goals related to wood burning. And that's what this resolution is largely about. We're basically saying that burning wood is inconsistent with clean air. Next slide, please. The reason for that conclusion is that wood smoke is the primary source of human-caused particulate matter and the primary source of something called polyaromatic hydrocarbons, which are present in large quantities in our ambient air. You've heard a lot about PM already from Nadej on Tuesday, so I won't go into that so much, other than to note these startling statistics that show that when we reduce PM, we save lives. But polyaromatic hydrocarbons probably don't get as much airtime. These are aromatic carbon rings that are produced during the combustion process. and some of them actually hitch a ride on the particles, and those tend to be more carcinogenic. So the DEQ actually in an analysis, the Portland Air Toxic Solutions analysis, found that these polyaromatic hydrocarbons, the primary source of them, about 2/3 of the total amount, come from burning wood, which was a bit of a startling conclusion, in my opinion. And in order to kind of get to what the state considers the healthy level or the ambient benchmarks, we would need to reduce polyaromatic hydrocarbons by 96%. So obviously, addressing wood burning is a key component of any strategy that's going to bring these concentrations of these toxins down to healthy levels. Next slide, please. This is a modeled study from the Department of Environmental Quality, and we're going to hear from them a little bit this morning as well. And it shows the distribution of wood smoke pollution throughout the region. Similar to diesel, we can see that all of us live in a hot spot. If we live in, especially the urban areas of Multnomah County, we live in a wood smoke hotspot. What I think this map belies a little bit is that the experience of air pollution, particularly from wood burning, can occur not just at the ambient level, but also at the micro level. A single person heating their home with wood can send their neighbor to the urgent care in search of medical attention if they have a pre-existing condition that disposes them to breathing difficulty. It can blanket an entire, park in harmful levels of pollution. So while we're certainly concerned about the ambient levels, the kind of micro neighborhood levels are concerned too, and that's largely becoming more apparent to us as low-cost sensors are becoming more widely dispersed throughout the community, and people are able to kind of look and see what's happening right outside their front door when it comes to air quality. Next slide, please. Okay, thank you. That's right. I've got two screens going, so I got my notes over here. So, of course, as with so many environmental issues, the distribution of wood smoke pollution, of course, does not occur equally across the community. And again, we can look at an analysis from the Department of Environmental Quality and see that the distribution of wood smoke pollution disproportionately burdens communities of color. In particular, their analysis found that Latinx populations are at the highest danger of disproportionate impacts from wood burning. So, this becomes important as the board is focused over the past 2 years on COVID, and we've seen the trends in COVID mortality and morbidity skewing towards populations of color. That I think is at least in part linked to environmental exposure to air pollution. Next slide, please. And of course, burning wood also contributes to climate change. So this is actually a new analysis that we did for this presentation. We used IPCC emissions factors for carbon dioxide and other heat-trapping gases, and found that the estimated consumption of wood annually contributes, you can see the number there, but about 30,000 passenger cars worth of emissions a year. That's about 2% of our overall emissions. Just a few caveats. That estimate of wood burning is only related to home heating. So it doesn't include, commercial combustion of wood. It doesn't include, backyard recreational combustion of wood. It's really just that residential home heating component. And we currently don't include those figures in our emissions inventory for our greenhouse gas tracking purposes. So this is sort of an unaccounted for contributor to our emissions. Next slide, please. So with this vision of wanting to align, to set a clear health vision for the community, we were fortunate that just this year, the World Health Organization updated their air pollution guidelines. The World Health Organization estimates that 7 million people a year globally die prematurely because of exposure to pollution. The vast majority of those deaths are attributed to exposure to particulate matter. And it's actually interesting that those deaths are largely affiliated with wood burning or biomass combustion. Throughout the world, a lot of that's attributed to home cooking, but it's indicative that the biomass combustion is an extremely unhealthy pollution source. The standards, the World Health Organization, or I'm not going to call them standards, there's no regulatory component to them. The guidelines that the World Health Organization has set out are considerably lower than our current EPA guidelines, as you can see in this comparison. Next slide, please. Here is a slide I borrowed from a work group partner, Tori over here, who will speak in a second. This slide, the very top line shows the current ambient standard from the EPA of 12 parts or 12 micrograms per meter cubed. The next line down, 10, shows where we think the EPA will go with their revised PM standard that we think is going to occur in the summer. And then the dashed line is the maybe they might go even lower. We're not sure. The red line is that 5 micrograms per cubic meter line. And so you can see that we're consistently, and then the sort of squiggly lines, those are the lines from our reference monitoring stations. Those are the DEQ sort of EPA required monitoring stations. And you can see that for the 3 reference stations that are on this chart, we're consistently below the current threshold. We're occasionally above what we think is going to be the revised threshold. But we're always above that. Currently, we're always above that World Health Organization guideline. So I think this shows that we have got quite a long way to go to get to what consistently clean air we would consider consistently clean air. And next slide, please. So that brings me to the end of my presentation. And that, I'll leave us on this image and on this vision that's articulated in the resolution, that our goal is clean air for everyone, all the time, everywhere. And this framing, I think, is important because it's a targeted universalism framing. This is a universal goal that I think we can all agree on. We know that it's not currently the reality for any of us, but it's even less of a reality for certain populations. And with the pilot program that Commissioner Jayapal started us out with, Wood Stove Exchange Program, it's in recognition. Our strategy will be in recognition of the fact that certain communities are disproportionately impacted, and so we're going to take a targeted approach to the application of resources. And we'll be hearing more, of course, about this next week when our environmental health team comes and presents on changes to the resolution. But for now, I think I will turn it over to our invited speakers. We have Dr. Moseson. Dr. Moseson is a pulmonologist, so of course she's very busy treating people with COVID. So I'm gonna, if it's okay, we'll maybe ask Dr. Moseson to go first.
Good morning.
Thank you. I appreciate it. And, I'm coming off a night shift, so if I'm a little slow, apologies in advance. Well, thank you for inviting me to be here today. My name's Erica Moseson. I'm a lung and ICU doctor and the pulmonary section chair at Emmanuel Hospital, a member of the board of the American Lung Association of Oregon and on the American Thoracic Society Environmental Health Policy Committee. And just to note, the ATS strongly advocates for a standard of 8 and are in support of the WHO guidelines of 5. I'm also the founder of Air Health, Our Health. As a native Oregonian, I definitely grew up loving the large wood-burning fire in our drafty old home, as well as the bonfires when we were out camping at the river. However, I have come to recognize that my nostalgia for these wood-burning fires does not mean that they are healthy for me to breathe any more than the nostalgia of a cigarette smoker means that their habit cannot be deadly to them and those they love. Combustion of fuels, whether they're tobacco, wood, diesel, or more, leads to a variety of toxins, but is also particularly deadly form of PM 2.5, which I know you've heard about, a very tiny particle that can bypass being trapped in our upper airways and actually penetrates deep into our lungs, sliding across a tiny 2-cell thick membrane and going into our bloodstream and just circulating throughout the body, causing disease in every organ our bloodstream reaches and from womb to tomb. So pregnant women exposed to it have premature deliveries and give birth to children who are smaller for age. Exposure can stunt the growth of a child's lungs and increases the risk of that child developing lung diseases like asthma over the course of their lives. It can damage the body in just every organ, heart disease, heart attacks, strokes, lung disease, and decreasing brain function of both adults and kids. And I care for many in my clinic and ICU who struggle to afford an alternative. We don't have great data, but at least 6% of Oregon residents surveyed in 2011 stated that they had been told they had COPD. But those of us who treat those with obstructive lung disease know it's often undiagnosed, and so the number is much likely higher. Cost for this care falls disproportionately on taxpayers, as patients with COPD are more likely to be unable to work, often have a household income less than $25,000. Asthma is also a very significant burden in our state, affecting 10% of adults and only 7% of kids. And I care for many of these patients in my clinic. And so the burden of airway disease is often multifactorial and generational. When you can't breathe, you can't work, and you can't go to school. So when you have to miss school days as a kid with asthma, you're more likely to fall behind academically and economically. All of these factors lead to people with, chronic illnesses, and the ones that I see most often are things like COPD and asthma, kind of being trapped in this generational cycle and being often unable to afford clean electricity for their homes. I have so many patients who have obstructive lung disease who know that the fireplace or wood stove or running whatever combustion source they're using for heat in their home is absolutely making their breathing worse. But they have to choose between heat and burning wood because wood is often cheap or even free, especially for those living in areas where they can readily access it for free from the outdoors. And they'll continue to, heat with something in their home that they know is making them sick. Or they'll live in communities where even if they manage to decide to pay their electricity bill because they know how bad it is for their health, they're living in areas where their neighbors are not making those choices. And so they are really impacted by the burden of smoke. And then a lot of people who end up working in the service industry often might not get a reprieve if they go to work where there's, ambient fire being used either for cooking and over open flame or for decorative reasons. And you can just end up with this kind of catastrophic downward spiral for someone's individual health as well as the family economy, right? So parents missing sick days, having to go to the doctor, having, increased healthcare expenditures, often for people who don't have paid sick leave. And then also if kids are missing sick days, having to stay home with that sick kid for asthma or, whichever their burden is, again, taking a hit to the family economy. And in addition to that toll on human health and direct healthcare expenditures, there's also cost in worker productivity. So over 25% of people in Oregon with asthma have missed more than one day of work due to asthma. And obviously our local businesses and our healthcare teams, which I'm feeling all the time, are already struggling with massive staffing issues. So it's not just a drain on the individual health of these communities, it's actually really a big drag on our economy as we're trying to recover in any kind of way from the pandemic. And then talking about the pandemic again, all of us working in the ICU are extremely familiar with the outsized toll on communities of color and our Latino community in particular that this pandemic has had. And with the link between COVID-19 and PM 2.5 exposure, around 17% of attributable mortality of COVID-19 being related to its interaction with PM 2.5, it's been really hard not to wonder if some of the deaths and disease and long COVID and everything caused by this pandemic has been caused by this poor indoor and air quality and outdoor air quality affecting that community in particular. You know, I always say, don't light things on fire and breathe them into your lungs. We literally have to stop smoking as a community, and especially those who are so vulnerable. You know, my patients, and you know, and more. And I just think about all the generations of kids, you know, growing up in these homes who will likely become my patient in the future. And I would really like to avoid that. So anything we can do, I love that slogan of clean air for everyone, everywhere. I think anything we can do for that is completely worth the effort. It will pay off. Whatever dollars we invest in clean air will have a beautiful magnified effect on, you know, both our health, economic productivity for the individual family, as well as, you know, I think for our entire community. So thank you. I don't know if people have questions or what I'm supposed to do.
I think you did perfectly. Thank you. Thank you, Dr. Moseson.
Okay.
Good to see you again.
Thank you.
Thank you, Dr. Moseson. I'm going to invite Tori up from the Department of Environmental Quality. Tori is pinch hitting for Ali Muzakalibi.
Hi, thank you so much for having me, Chair Kafori, and the rest of the Multnomah County Commissioners. Bear with me, it's the first time I've spoken in public in 2 years. I'll do my best. So yeah, thank you again for the opportunity to speak and for all of your work in prioritizing the local regulation of wood smoke. I want to highlight the importance of local action on this issue, which is crucial when conditions can create inversions that pose health hazards in like specifically geographically limited areas, which are often hard for the state to regulate. These wood burning often has hyperlocal impacts on marginalized communities who are already bearing a disproportionate burden of other sources of air pollution. We appreciate, as always, the cooperation and leadership of the county as a partner in improving environmental and community health. I guess my name would be good also. My name is Tori Hiru, and I am an air quality planner with Oregon Department of Environmental Quality. So as we all know here, exposure to wood smoke can have serious health consequences for people with asthma or other respiratory issues, heart conditions, and other illnesses, and can also contribute to long-term health problems of its own, like heart attacks, strokes, emphysema, and bronchitis, some of what Dr. Moseson was talking to you about. Study after study reinforces our concerns about the health impacts from wood burning, and they keep coming. Just 2 weeks ago, Harvard School of Public Health released a 4-year study indicating increased risks of mortality from PM 2.5, even at levels below the federal standards set by EPA. The study reported a 6 to 8% increase in the risk of mortality for older Americans, so folks that get Medicaid. So a 6.6 to 8% increased risk of mortality for older Americans per 10 micrograms per cubic meter of increased exposure to PM 2.5. So it's a pretty significant increase. In fact, EPA is so concerned about these health impacts of the exposure to small particulate matter that, as John said, they are considering lowering the NAAQS standard for this pollutant, and this would take effect in summer of 2023. The actions that Multnomah County takes today is an important step to ensure this area's long-term attainment with federal PM emission standards. So, you know, we all want to do better than those standards, as John mentioned, but with the standards lowering, these actions can have an actual impact on the ability of the area to stay in attainment. In terms of the scale of the problem, residential wood combustion accounts for approximately 20% of PM 2.5 emissions from anthropogenic sources throughout the country, according to our emission inventories over the past 10 years. 19.86% to be exact. And programs like the one being implemented by Multnomah County balance the need for cheap, affordable heating with the need for clean, breathable air in our communities. People need regulations and incentives to discourage unnecessary burning and encourage change out of wood burning equipment. In Oregon, we have a long history of utilizing wood stove curtailment and change out programs to secure attainment with PM standards. And we're really pleased to see Multnomah County being proactive, as usual, and continuing to prioritize this issue. Presently, Beyond curtailment programs, DEQ is finding the most success in funding changeouts to non-combustion sources of heating and cooling for home use. So we're excited to hear the county is working on the same thing. We encourage the county to continue to explore ways to support that work, and we're open to further discussions about collaboration in that area. As we look to the future and the reality of climate change in the Pacific Northwest, the Oregon Global Warming Commission tells us we will have increased incidences of extreme weather events, as we have over the past year, like ice storms and heat events and more wildfire smoke. All of this points us toward developing policy that can cultivate more community resilience and to temperature shifts specifically, along with everything else. We need more adaptable, cleaner, and more effective home heating and cooling systems. This, I think, also includes exploring further strategies to manage biomass through alternatives to burning. We look forward to continuing to partner with the county on these efforts. Thank you again for your time and your consideration of this issue.
Thanks, Tori. And then the godmother of clean air, Mary Pivito. The fairy godmother of
Excuse me, I haven't seen this one. I thought you said ferret, and I thought, how is that a compliment? But okay,
Yeah.
fairy godmother, I do like better.
ferrets are cool too.
Hi, so my other name is Mary Pivito. I'm the Executive Director of Neighbors for Clean Air. Thank you, John, for the invitation. After listening to the testimony already, I feel this was a gratuitous, I'm so unnecessary, and that is so gratifying. I'm so profoundly grateful, though, to be here in person, but also because, as I listened, honestly, Tuesday to John's presentation and Nadej's presentation on the wood smoke ordinance that you were taking up today, it was with such appreciation for the work that the county has consistently done to protect residents from the dangers of air pollution generally. Growing evidence of these dangers posed by breathing particulate matter, PM, has been building for decades. You heard a lot from Dr. Moseson, from Tori, and from Nadej. But really, since the EPA established the Clean Air Act, the evidence of the risk is just growing stronger. Exposure to fine particulates, especially to our children, but with the newer study and understanding of the risk that older Americans, even at very low levels, are breathing. This train is not going in the other direction. And it's coming from all the sources, whether it's smokestack emissions, whether it's exhaust from tailpipes, automobiles, wildfires, wood smoke, it's coming from all the sources. And so the county, what I most appreciate is the county gets what most people intuitively know. Our lungs don't differentiate between regulatory sectors. So whether it's been working to establish health-based standards in our industrial permits, the work to address the biggest dangers caused by the operation of older diesel engines, or this wood smoke initiative, over the last 10 years, the county has been the most significant ally in the work for clean air. And it's because of this county's unfailing commitment that we are seeing things like the clean diesel contracting standard, and we're seeing things like this wood smoke initiative, the leadership that you're taking. The strong and unflinching focus on public health risk has also made a really profound impact on how our state regulates air, and I'm really grateful for that. Because 10 years ago, when I finished serving on the Portland Air Toxic Solutions Advisory Committee, I left with nothing more than significant evidence of the problem. And really, there was no infrastructure of advocacy that really existed at that time. But that's when my work with the county started. I sincerely believe that everything we have accomplished in these last 10 years has been in no small part, if not completely, because of the partnership with the County Board of Commissioners. By demonstrating a high regard for the data, the evidence that illustrates risk, the county has provided the strength and credibility that advocates so desperately need in the very complex work for clean air. And it should be noted we're not alone anymore in this work. The bold action the county took to listen to one crazy air lady 10 years ago has now been bolstered by the advocacy of so many people. And that's evidence, and I want to make sure to draw your attention to the joint testimony provided by Smoke Free PDX, Oregon Environmental Council, 7 other member organizations, and almost 50 people individually signing on to support what you are voting on today. I think that's huge testimony to how much support and strength your work has done to build a stronger movement for clean air. And Chair Kafoury, I think this might be my last chance to have the honor to sit before you under your leadership. And while I acknowledge it started before with your predecessor, I believe it has been your leadership and your incomparable commitment to keeping this a priority for the county that's made the work and the real progress that we've achieved, and I want to thank you. Whether it's clean air, whether it's been the pandemic, the plight of those experiencing houselessness and other social disparities in our county, I'm grateful to your legacy and what you are leaving in this county. But I'm also confident that I'm probably sitting in front of your successor. And that ensuring equitable access to clean and safe communities and protecting public health is embedded because of your legacy in the county culture. So as I presume that your successor is here, I want to say that I look forward to many more years of partnership in this work. Thank you.
Thank you, Mary.
That's the last presenter that we invited.
Marina, did we receive any public testimony on this item?
Yes, Madam Chair. We received 2 written comments and 1 oral testimony. All were shared with board members and staff. We have 1 oral testimony from Sandy Polishuk. Let me, just 1 second. Sandy, I'm going to unmute you right now, so you're unmuted. You're welcome to begin your testimony. You have 3 minutes. Can you hear us, Sandy? Hello, Sandy. We're not making contact. And so that was the only testimony we had.
Is that Sandy?
No.
Well, I think we all know Sandy, and we know where Sandy stands on this issue, and we'll thank her anyway for attempting to join us this morning. All right, well, we will have time for commissioners. I'm going to start with Commissioner Peggy Peterson.
Thank you so much, Chair. So thank you so much, John and Dr. Mosenson and Tori and Mary for the testimony today of bringing this, of helping support this really important resolution. I feel like I talked a lot on Tuesday when we had our briefing about all of the work that went into getting us to this place today based on the work of the amazing task force members that did that. There are just a couple things that I want to mention. One is that I think it is so important for us as a local government to be taking this action. As we saw through the presentation today, where the standards are at the national level in this country are not where they need to be in terms of the health and safety of our community members. And we really need to be doing the work at the local level to push that, to change that, to encourage them when they do make their decision this summer about what those new levels are going to look like, what those new standards are going to look like, that they do that, they consider health to the greatest extent possible and mirror the WHO as much as they possibly can. I don't know that they're going to get quite there, but this is our work and our effort in trying to get to that place. So I appreciate that. I just also wanted to appreciate the partnership of Commissioner Jayapal. We both testified this morning on a bill to get rid of diesel fuel and move to renewable diesel fuel. So we are working on this on all fronts, but this is what we can do here in Multnomah County with this effort and the effort that we're going to do with the ordinance later this month, and just really excited about this and know that these are steps that we need to continue to take to care for the health and safety of our community members, especially the BIPOC community members that we know are so impacted by this for health reasons. So that's all. Thank you so much.
Thank you. Commissioner Stegman.
Thank you, Chair. Yes, thank you to Commissioner Jayapal and Commissioner Vega-Peterson. It seems like everyone has had a hand in getting this resolution across the board, so thank you. I did have a couple of questions, and also thank you, Mary, and to Dr. Mosen and Tori as well. John, thank you so much for sending that information. You sent me a little chart that showed like kind of the difference between how much fireplaces versus wood burning, and it kind of looked like it was pretty significant. And I don't know if you have like an approximation of what percentage that is.
In terms of the contribution of different appliances, yeah, the I think wood stoves account for over 60% of the emissions from home heating appliances when it comes to the breakdown. These data are a little bit difficult to work with because they're obtained via survey, and so we don't necessarily we don't necessarily have like a household by household count. So they're estimates, but that's the best estimate we have is for that.
But that was really helpful because I don't know that people. I think we've all shifted our thinking of what we thought were contributors. And I wasn't sure, fireplaces or wood stoves, but clearly a majority of it is coming from wood smoke. So I do appreciate that. And really excited to hear about, I hope the testimony went well this morning to phase out diesel. Very exciting, and big shout out to Keith Wilson at Titan Freight if he's watching or listening for leading that charge. I did have another question. You had talked about the DEQ monitoring stations, and I know at one point there was one out in the Rockwood neighborhood of Gresham and Centennial. I don't believe it's there anymore, but I'm just wondering if you have any idea, like, I guess what I'm concerned about is we know that there is a concentration out in East County, and is that being monitored and looked at?
I might invite Tori to come back up, but I'll start to reply that the DEQ is required by the EPA to have these reference monitoring stations, and they actually have to be fixed in the same location over a long period of time, and there's a process by which DEQ can ask to move those stations, but they have to get approval from the EPA because the intention there is to have this long-term stable data that they can use to document compliance with the national air quality standards. The DEQ has also deployed something that they're calling it the Sense-OR network, the Sense-OR, for Oregon network. These are lower cost particulate matter monitoring devices that they deployed throughout the area in fixed locations. So they've greatly expanded their PM monitor. Tori, you're not going to help me out here. PM monitoring network, and I can't tell you if that Rockwood station is up and operational right now, but I think we could probably figure that out really quickly and get back to you and figure out whether or not it's there. I don't know, Tori, do you have anything to contribute?
Yeah, I think I'm going to have to get back to you on that specific station. I do believe it is not currently operational. There are plans definitely to expand the network and to pursue grant funding from EPA to do more of like a mobile operation so that we can look at different areas as opposed to what John's referring to, which takes up a lot of resources, the federal reference monitor network, which has to be in a specific location long term. There's also, beyond what DEQ has, there's a lot of purple air networks being put together, mostly by community groups, that we are trying to develop some resources within our monitoring group to help people understand better what those are telling us about particulate matter emissions and levels in different areas. And shout out to Neighbors for Clean Air, who is one of the groups doing some great work in that regard and has definitely focused on putting monitors in East Portland, which we know we have a huge gap there.
And Gresham.
Yes.
We're currently partnered with Mary and the city of Gresham to get some of those purple air monitors out to some businesses that are interested in hosting those monitors. So they're not quite the reference level, like grade A data quality, but they're very useful for kind of telling us, where air quality is moving and in terms of a trend. And then we'll find out about those the higher quality sensors that are deployed by the DEQ.
Yeah, I will follow up with John about information about where else we have monitoring right now.
Great, thank you so much. I'm excited to hear that there is monitoring going on, especially in East County and Gresham. So another great day, and thank you all so much for the resolution.
Thank you, Commissioner.
Commissioner Myron.
Thank you so much. I'm going to just continue the inspiring conversation that we're having now and the support for all that's been brought before us today. So I want to thank again Commissioners Jayapal and Vega Peterson for your continued work on wood smoke, and our panelists are just epic. There doesn't have to even be a reason for you to come and speak. I think it's great to just have you here to talk and always learn something. And Dr. Moseson is an incredible leader in the community health world, and I've been so grateful to partner with her on so many issues over the years. And Tori, it's great to have you testifying in person. It's still new and so wonderful. And of course, Mary, there are no words, and just thank you for continued leadership and everything, and John as well. So, we talked about this we talked about this during our briefing, and I think we're going to have yet another hearing on an initiative, but it just really is important to emphasize sort of the history and that how this arose from community. And I just still remember people from when I first started at the county, community members bringing this forward and elevating the issue and its importance. And so that gives us as board members, gave me an opportunity at the time to learn more and then to act, to do more. And as has been emphasized again here, learning that Multnomah County has some of the worst air in the country, and learning more and more about the degree of contribution from wood smoke to poor air quality, and in particular the carcinogenic risk, which I had no idea. And as a physician, I knew about particulate matter and respiratory illnesses and that, but the cancer risk was really shocking. And so this allows us to act. And I think that I love Commissioner Jayapal's description of we need clean air for everyone, everywhere, all the time. Just should be on billboards and on buses. And it is a great motto, and it's a great way that we need to engage with this work. Focusing so importantly on the impacts of our most marginalized communities who are exposed to the worst of the worst air, and in particular, looking at the impact on our elders who are too often left out of conversations about so many health impacts and so much, housing, a lot of the work that we do. So we just need to keep listening, keep engaging with community, and keep taking those meaningful steps. And the environment it's big, but I am so grateful for the opportunities that we have to make an impact here at the county level. And, we need to keep doing whatever's in our power to advance environmental justice and climate justice and public health and prevent that harmful impact of wood smoke on people and our environment.
Commissioner Jayapal.
Thank you, Chair. Just more thanks to everybody. Thanks for all the work that's gotten us to this place. Thank you always, John. Dr. Mosesen, Tori, Mary, for being here. Mary, for your, starting to beat this drum when no one was listening 10 years ago or whenever it was. That term of you're the fairy godmother of clean air in Multnomah County, I think is really appropriate. Dr. Mosesen, really appreciated your pointing out the generational impacts of air pollution and wood smoke and the ripple effects, that it is a health issue, that it's a family economy issue, that it's really interwoven with so many of the things that we deal with. And I mostly want to thank the work group. My team and I had started looking at some incremental things that we might be able to do, but it was the work group that came forward and created a framework and a broader macro vision and strategy. And that phrase, thank you for thanking me, but it really was the work group that came up with the phrase, clean air for everyone, all the time, everywhere, and saying, no, it's not enough just to take incremental steps, although that's great. We need to take those steps with a view towards what the overall goal is. What's our purpose here? And what are the pillars that are going to kind of create the framework for continuing to build on the progress that we've already made? So just a lot of gratitude to the work group. You really are responsible for where we are now. Thank you.
Commissioner Segman, I got a text from Nadej. there's a DEQ sensor at Centennial High School. Yeah.
Thank you, Nadej, for your quick response. Well, as usual, I will echo the thanks that have been given to our panelists.
I'm sorry.
Yep.
Do you want to?
Sorry, Sandy was able to join via phone.
Oh, great.
If you're okay with
Yep, go ahead.
Sandy, just 1 second. Sandy, are you there with us? You'll have 3 minutes.
I am. I was on the feed too, but I couldn't figure out how to unmute myself. It was the first time on that platform for me. Thank you very much for calling me. Chair Kafori and commissioners, thank you for this opportunity to speak. My name is Sandy Polishuk. I live in Northeast Portland. In 1993, a few days after Thanksgiving, I'm sorry, my son Fred died during an asthma attack. He was 6 weeks shy of his 26th birthday, on track to graduate in geology from ASU in March, and becoming a father for the second time in April. According to the EPA, Portland is number 2 U.S. city for highest concentration of wood smoke air pollution. Fred was born in Portland and lived here all of his life except for 1 year at the U of O. He suffered from asthma from an early age, and it worsened over the years. By the time he was in his 20s, he was a frequent ER visitor. I was going to explain the connection between asthma and wood smoke, but you've already heard plenty on that today. What I do want to tell you about is life cut short. A caring, playful young man lost before he had a chance to reach his potential. And about those he left behind. A child who never knew his father, but wore his photo in a locket. Another too young to retain the memory of his adored daddy. A young pregnant woman, traumatized and frightened. Siblings, parents, grandmothers, cousins, all in grief. A crowd too large to accommodate at his memorial. Years lost. Fred not only missed seeing his children grow up, he now has grandchildren who will never know him and who he will never see. It's not possible to describe the depth of my sorrow, our sorrow, from this hole in our lives and in the chain of our family tree. All I can say is nearly 30 years later, my pain is still profound. I don't tell you this story because I think our family's tragedy is unique or more tragic than other families' losses, but because it is not unique and because there are relatively easy things we can do to substantially reduce the risk of asthma, a risk carrying over 40% greater mortality for Black people. There is no good excuse for not doing everything we can do to reduce smoke pollution in Portland. Thank you.
Thank you, Sandy, and I'm sorry you had trouble getting on, but I'm really glad you were able to phone in. The message is really important.
Me too. Thanks for calling.
It's really hard to follow that.
Yeah.
That's kind of the drop the mic there at the end. But I do want to add my thanks to all of the advocates standing behind Wood Smoke Free PDX, Neighbors for Clean Air, and Oregon Environmental Council for pushing the county to meaningfully address pollution from wood smoke. And of course, I want to thank Commissioners Vega Peterson and Jayapal. Thanks to both of you for the work that you've put into the wood smoke work group and for bringing this resolution forward. Looking at that picture up there of those cute little kids reminds me of just how far we've come concerning air quality. And if you don't remember or you don't know, this picture was taken 5 years ago outside of the DEQ headquarters when we rallied in support of Cleaner Air Oregon, which is the industrial air toxics regulatory program that was written into Oregon law, really in large part because communities showed up and spoke up. And since then, our region has also implemented the Cleaner Air construction standards to limit pollution from diesel construction equipment. We've successfully advocated for laws to phase out the use of older polluting diesel trucks, and we've advocated recently for the adopted rules that will accelerate our transition to all electric new trucks. And we developed the wood smoke curtailment program that we continue to refine and improve. So it feels both right and necessary to formalize our values and our commitment to clean air that drove all of those actions. I'll never forget what Dr. Paul Lewis, our former public health officer, said about kids the day that this picture was taken. He said, they're like hummingbirds. And you can see those cute little hummingbird cutouts that they're holding in their hands. Kids, like hummingbirds, are small, but their hearts beat faster and they take more breaths than we adults do. And that rapid breathing exposes kids to more air and whatever is in the air. Today represents another step on our path of protecting the most vulnerable in our community. Clearly, as we've heard from our colleagues and from those testifying, the county has not gotten to this point alone. We've only gotten to this point because of collaboration. Collaboration with the community, with the DEQ, and even with industry. And what's going to propel us toward the clean air future that we aspire to is doubling down on that spirit of partnership and bringing people along with us. We need to communicate effectively to people about the importance of air quality and what sorts of activities affect it. And that includes me. I mean, I simply didn't know until a few years ago that the recreational fires had such a negative impact on air quality and ultimately on people's health. We need to develop effective and accessible programs to help people get cleaner heat sources to warm their homes. We need to treat air quality not just as an environmental health issue, but also as the issues of equity and justice that they are. This resolution holds the county accountable, not just because we say we want to achieve clean air, but also because we know achieving clean air is possible, especially if we all work together. Marina, will you please take a roll call vote?
Commissioner Myron?
Aye.
Commissioner Jayapal?
Aye.
Commissioner Vega Peterson?
Aye.
Commissioner Stegman?
Aye.
Chair Kafoury?
Aye. The resolution is adopted. Now we have time for board comments on any non-agenda items, and I'm going to call on commissioners by district, and we'll start with Commissioner Stegman.
Thank you, Chair. Yesterday, I had the opportunity to host a workshop around, it's called Control, Alt, Delete, Hate Project, and they are a coalition to work on adopting a public health model to reduce violence and stop radicalization and extremism. Some of you may know Randy Blazak. He's a University of Oregon professor who's done some incredible work on the far-right extremist movement, and he's one of the consultants on this group. Next, I'll post on Facebook, but they are having another workshop called Active Bystander Workshop. I know many of us ask ourselves, what can we do as individuals to curtail the violence that's happening in our community. So there will be opportunities. I'll post it on my Facebook, but February 12th, 18th, 22nd, and 24th are workshops where people can learn more. And I think it's especially important as we saw that the district attorney released his bias crimes data dashboard. So I'm excited that there is some significant work and efforts to address the community violence. I know every day people are asking me, what can we do? And we have to do better. So I am very pleased to see this work moving forward, and we'll probably be hosting another East County issue forum to talk more about it. Thank you.
Thank you. And if folks could stick around, as soon as we're done, we're going to get a photo. So Tori, I hope you can stick around a little bit longer. Thank you. All right, Commissioner Myron.
Thank you. I will be holding a monthly virtual constituent office hour on Thursday, February 17th, 3 to 4 p.m. And I'll be posting my social media today about this event, how to register. You can find that on my website as well. And then I'm really excited to be partnering with Imago Dei to host a forum to bring leaders together to learn about homelessness, where they can engage, and sort of the landscape and how we can collaborate with a very broad coalition there. And Commissioner Ryan from the city will join us, and Joint Office Director Mark Jolin, and many service providers. So it's February 18th, 10 to noon, Life Change Church in North Portland, and would love to have you attend if you're interested. That's it.
Commissioner Jaipal.
Thank you, Chair. I just wanted to mention that this weekend I'm going to be joining the organization Word is Bond for neighborhood walks curated by local youth. And I know several of my colleagues have done these already. And I believe Commissioner Vega-Peterson is joining in Cali this weekend. So I think several of them are sold out already, but I'd encourage anyone who's listening to try and find one. It really sounds like an extraordinary opportunity to see our county through the eyes of our young people. Thank you.
Commissioner Vega-Peterson.
Thank you, Chair. Yes, I will be joining. I did look this morning, and they are all full. So, but I just think that shows the appetite and how amazing the walks are. So I'm really looking forward to that this weekend. On Saturday, February 26th, a couple weeks from now, we're going to be doing. I'm going to be holding a constituent coffee, and we don't have a date, or we don't have a location determined yet, but we're going to be doing it in the newly annexed part of District 3 in the new neighborhoods, for a chance for those folks to come out and have a chance to
Are you telling
talk.
me you're coming over to my house?
I'm going to come over. It's going to be at Chair Kafori's house, address TBD. And no, but I'm really looking forward to that, and some more information will be coming soon about that. Thank you.
We will welcome you with open arms. All right, well, that concludes our board meeting. Thank you so much for attending, and please stick around. We're going to have photos now that we're all back together in person. Have a wonderful weekend. Stay safe, stay healthy.